Welcome to the Medical Report podcast, where we bring health to your ears. We are your hosts, Zinzele, Olu, and I am Anita. This podcast is brought to you by our sponsors, Integral Care Medical Services, New Life Rehab, Graceful Hands Rehab, and Bantucola. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not adequate means to diagnose or treat you. We recommend that you seek medical attention from your healthcare provider if you want more guidance on your health. Or if you'd like to have an assessment by one of us here on the panel, you can reach out to us through our social media pages. If anyone in the audience has any questions for us individually or about our topic today, please feel free to leave your questions in the chat and we'll answer it later in the Q&A segment. If you are watching this after our live show ends, feel free to ask your questions in the comments as well. Also, be sure to like and share this video. We want to feel the love. So, how's everybody been feeling this week? What you guys been up to?
I'm tired.
Like that?
I'm tired.
You just tired?
I missed my sister's anniversary yesterday, but she hit me up on the phone. It's my anniversary. I was like, oh, happy anniversary.
You're right. Happy anniversary, sis, right? Okay.
Yeah.
Shout her out. Olu, what you been up to?
I just been packing up, ready to go on vacation next week.
Oh, where you going?
Ooh, going to Mexico.
Uh-oh.
Mexico. That's what I'm talking about.
Mexico.
That'll be fun. My sister just got married this past weekend. So I just got back from Atlanta. That was
Yeah, I see the nails.
You know, I had to.
Right.
That's what my hair done, nails done, you know.
Yeah, I'm going to North Carolina in a couple of weeks, go see my family.
Oh, awesome. That'd be a good trip. All right, so today we're talking about our professions. As we have said before, I'm a nurse practitioner, and Zinzele is a speech therapist, and Olu is a physical therapist. So we're going to tell you guys a bit about our journey. And so, guys, what made you choose your professions?
Olu first.
I was gonna say ladies first, but well, I knew that I wanted to go into the medical field. I wanted to be a physician at first, but then I looked at how long it took to get to where I wanted to be, as far as going to medical school and being in that much debt when you come out. And so I wanted to work in the area of like sports medicine. So I think someone had mentioned to me physical therapy. So I looked into it and I said, like, this seems like something that I can do. It seems kind of actually exactly what I want to do. And so I went into physical therapy and here I am.
Just that simple.
You did it. Zinzele, what's your story?
Oh man. So I'll make it real quick, like, because it's long. So basically, I had two kids, and one of my kids has moderate to severe autism. And I was at one of her meetings at the school district or whatever, and I saw this lady on the floor playing with her, and they said that's her speech therapist. And I looked at the lady. I said, what kind of job is that? You get to wear jeans and sit on the floor and play with kids and get paid? I was like, what?
Right.
So I figured, she wasn't getting enough services and everything. So I said, well, I can go do this myself, and get paid. So that's what I did. Went back to school and became a speech pathologist.
That's awesome that your daughter inspired that journey for you.
Yeah. So how'd you get into what you do?
So me, I always wanted to be a nurse. Ever since I was a kid, I was like, I want to be a nurse when I grow up.
Yeah, that was me. Until they started talking about bedpans. I was like, oh, Jesus on that one. I'm cool.
And then when I was around 16 years old, I had my first experience with a nurse practitioner. And then it was like, oh, wow, like this is cool. Like I didn't even know that nurse practitioners were a thing. And just the way that she spoke to me, the way she really explained things to me and took the time to just make me feel comfortable about what was going on. Like I didn't even know questions to ask when I went to the doctor when I was that young. And It was like she answered all my questions for me. I never even had to ask any questions.
That's true.
So nice to feel like informed and feel like I was a part of my healthcare decisions. And So yeah, that's really what sold it for me. And so I went to school and became an NP, and
Yeah,
here I am.
that's
Uh
the
oh.
difference between a nurse and a doctor to me.
Huh?
And that's the difference between a nurse and a doctor to me. They're a little bit. They'll sit there and actually listen to you a little bit longer. No shade to any doctors,
Yeah,
but sometimes with some physicians, you feel like you're in and out of there in
Yeah.
5 minutes, and they barely heard anything of what you said. But um,
Yeah.
the nurse
I feel.
practitioners I've dealt with actually sit down and listen to you, and they'll have a conversation with you.
Yeah, I feel like even if there's a limited amount of time, it doesn't really feel like it when a nurse practitioner. Like you really feel like they're really trying to get understand what you're saying and really help explain everything. But
Mhm.
Yeah.
so what schooling is required for our professions is the next question. So for me, you have to have. I mean, there's many routes in nursing in general. You can start all the way from backing it all the way up to the certified nurse assistant. Then you go to the LPN, the RN, all
Oh yeah.
the
I
NP.
thought that was the only route for the
So
most part.
no. So my route actually, I after high school went straight for my RN. I went to when I went and got my bachelor's degree from Florida Agricultural and Mechanical University. Yes. Um, once I got my bachelor's degree, I was an RN and I started working in ICU right out of college.
Mm.
So once you get that bachelor's degree, then you can go ahead and get your master's or doctorate in nurse practice to be a nurse practitioner. So you have to have that bachelor's in order to do the next step of NP though. So there are some people that stop and just do LPN. There are some people that just do RN, and there's either the associate's RN, which is only 2 years, and then the bachelor's RN is four.
I've,
So that's the difference between the two.
I've got a question because I've always been confused by the different types of nurses out there. What's the difference between like a BSN, an RN, and an LPN?
So technically, the RN is able to more so delegate tasks to the LPN. The LPN is not able to do certain things in certain states. Like, for instance, they can't give IV medication. They can pass medication by mouth, but they can't give like IV meds. They're they're very. I've met so many LPNs that are super smart and well equipped, almost like they function just like an RN does. Um, but there are certain things in certain states that they're limited on. So the training is not as long for LPN. It's only about I think a year and a half to 2 years, depending on the program. Um, and so that's kind of the difference where that comes in.
And that's an associate's degree?
The LPN, I believe, is an associate's, yeah.
Okay.
But with RN, you can have the associates, which is the 2 year, and then the bachelor's, which is the four.
Okay.
Yeah. But with the nurse practitioner track, there are many different tracks in the nurse practitioner world. So there's different specializations: family nurse practitioner, psychiatric nurse practitioner, um, pediatric nurse practitioner, adult
Wow.
gerontology, what I am. So there are different things that you can go into, and you have to choose whether or not it's primary care versus acute care that you're going into. So that's another thing you have to think about when you get to that NP situation. But
Mine is pretty vast. It's like I can either go medical or I can go into the schools. But see, I tried schools for a year. I can't deal with them kids. I can't do it. Can't do it. It's not the kids, it's the parents. It's the
yes,
parents. Lack of participation, not getting involved, don't know what's going on. I'm trying to get Johnny on the phone. I'm sorry, Johnny don't want to get on the phone. Get him on the phone. What? Get him on his phone. But
right,
yeah, so you can either go the school route and you can basically work with speech and things like that with kids in high school, middle school, elementary, or you can go the medical route. So I decided to go the medical route, and medical route make more money. So I
right,
was like, about that.
yeah,
So the only thing is, like the schools, you get the summer, that's always cool. But medical, you don't. I have to admit, all three of us probably know that we don't get holidays. No such a thing.
Nope.
No, there's no Christmas. And my family still to this day asks me, I've been doing this for years. You don't get Christmas off? No, baby, we don't get Christmas, Thanksgiving, nothing.
I mean, in the primary care world, sometimes they do, depending on where you work.
Offices are closed.
But then there are some offices that'll be open half day.
It depends
Yeah,
on what setting you're working in. In the nursing home,
yeah,
you still gotta come in. In the
yeah.
hospital, you still gotta come in. If you're working outpatient in a clinic somewhere, you're probably gonna have holidays off.
Yeah.
Um, but to answer the question about, you know, schooling, that was the question, right?
Yeah.
Yeah. So for physical therapists, it's pretty simple. You need a 4-year bachelor's degree. Usually it's in health science or biology or something related. Usually they're mostly concerned with PT school, the prerequisites, which is usually going to be anatomy and physiology, biology, chemistry, physics, a few other things like health law. After that, you're going to go to PT school, which is now, I want to say it's a doctorate everywhere. When I was in school 10 years ago, there was only 2 schools left over. They were still doing master's degrees. Um, so they should all be doctorates by now, basically. After that, you can go into literally any kind of setting that you want to. You can go into hospitals. You can go into pediatrics. I did pediatrics for 4 years. Like she said, arguing with parents about actually following through on the activities that you give them to do.
That's it.
Um, I've worked in nursing homes. I think I have worked in, it's easier for me to name the settings that I haven't worked in than it is. I haven't worked in hospice. I haven't exactly done the school system before, but I have worked in school. Um, but once you finish PT school, you can branch off and do a variety of things because the thing about PT school is it's not like they teach you everything. They teach you how to do everything, and then you pick that area, and then you kind of learn a little bit more as pass the licensure exam and work in that field.
Uh, Schooling necessary for speech. You have to get a 4-year degree. Now you can come in with a psych degree. You can come in with and go into those fields, but it would be best. It would be ideal for you to get a degree in speech pathology, the actual field itself, and then to go into grad school with that. I've seen people come in with a biology degree and go into grad school in speech, and they do fine, but there's a lot that they're missing, and they're less likely to get in because right now it's about maybe two, at least the school I went to here in University of California, Sacramento. Um, is 200 students for a 30 slot.
Mm,
So if you've got 200 speech pathology undergrads trying to get into 30 slots for a graduate program, they're unlikely going to take a psych major. You see what I mean?
right.
So yeah, so it would be better. So it was 4 years of undergrad. You've got 2 years of grad school. Then you've got your internship for a year, and then you've got a fellowship. So both of it, all of it together, it took me roughly almost 9 years from start to finish.
Mm. See,
Yeah,
and that's what I liked about PT is like once you were done, you were done. There were
Yeah.
no, I mean, there are people who do residencies in certain areas right after because they want to, polish themselves for that field, but you don't have to. I mean, you can jump right in. Once you get your degree and your license, you're good to go.
Yeah, it's the same thing in the NP world. I think that the difference though comes well, sometimes it's like it's more beneficial if you do have experience in nursing for at least 2 or more years before you become a nurse practitioner, for sure. I think whenever that happens, then the nurse practitioner is much better prepared for taking on that role as a nurse practitioner.
yeah.
Because there are some schools that are accepting nursing students straight out of nursing school and going into NT world, but you really need to have that hands-on experience with patients to really feel more comfortable once you become a nurse practitioner. And there are some residency programs for NPs, but there's not that many.
Mm.
So we really, really rely on our experience that we have had before becoming a nurse practitioner. So before I became one, I worked in ICU, I worked in home health, I worked in inpatient psych. So I got a lot of different things, and psych is. I'm now back in school again for psych, so it's it's another passion of mine, newfound passion. Um, so
I was working customer service for Verizon. I wasn't doing. I was working customer service jobs. I was working for Bank of America. I was a supervisor there. I was doing all kind of, just regular jobs, And I was like, man, it's time to go back to school because I can't do anything with this.
but you chose well, though. You chose
Yeah,
well.
yeah, yeah.
Yeah, definitely. So with I know that all of us have worked in telemedicine.
Yeah,
So as the pandemic hit, telemedicine has grown in popularity because it helps us connect with our patients electronically. And, that could be a means of whether it's on the phone or whether that's on a video call, which is the most common. There are also other methods like email, even, but I know that the most common or wanted method is video, at least, because then you can see the patient because you're not in
right,
the
right.
facility in a normal scenario. So tell me a bit about how you like what do you have you guys commonly treated via telemedicine in your fields of speech therapy and physical therapy?
Um, as far as physical therapy, I know most people think that everything we do is hands-on. And we do some hands-on things, but I would say PTs are educators too. We educate you about your body, and a lot of what I can do, I can tell you what to do through video, depending on whatever your issue is.
He said I could tell you better. I could show you.
Right.
Basically, now you have to be honest with yourself and the patient that there are just some conditions that you can't treat through telehealth. Someone who just had a stroke isn't going to benefit from you not not physically being there to help them do some of these things.
Yeah.
Um,
See, I always thought the physical therapist had to be there to move your arm, put it in the right back, put it over here.
Not
Mhm.
everything. So for example, let's take the pediatrics. I can do pediatrics through telehealth. So let's say that I had a kid who's developmentally delayed, premature, something like that. I could demonstrate with the doll here the positions and the exercises that you would have to do, and you, mom, on the other side of the screen, can be actually doing it. See,
Huh.
I don't have to be in there touching your kids.
Right.
So it's more helpful if you have an assistant to help out with that.
Exactly. And truthfully, I've done early intervention before, and that's exactly what they want you to do. They don't want you to come into the home and move the kid around. They want you to educate the parents and show them how to do it when you're not there.
Right.
And I always wondered when I was doing this, I was like, I can just do this through a computer screen. I don't have to be here for this, really. But that's
See,
not
that's how
where.
black folks are. Like, why I got to do all that?
It's like those meetings that could have been an email, that we just
Right.
Basically, yeah, but see,
Exactly.
you have to be really honest because you can't have somebody with balance impairments doing balance exercises in their house, and you're not
right.
there to teach them. You know,
It's not gonna work.
on the
Yeah.
ground.
It's not gonna work. Yeah,
Mm.
I definitely understand that.
But
So,
but
Zizana, from speech therapy standpoint, what have you treated via telemedicine?
Of course you can. You know what? People would think that speech would be easy to do via telemedicine. It's actually quite difficult because there's more involved than just looking at somebody's mouth. There's a lot of different articulators, which is different things you need to make speech. So if I see you and you come and I don't know, you got four teeth missing in the back. Well, that might explain why you can't, or you have a lisp. I mean, all kinds of different things. So if I can't see your tongue movement, all kinds of things make it can make telemedicine difficult, but don't mean you can't do it. It just means that it can be difficult. I think swallowing, so we've got three areas for people that don't know. Speech pathologists on the medical side, you can do speech, you can do cognition, which is just memory, judgment, reasoning, or you can do dysphagia, which is swallowing problems. So swallowing problems are probably the most difficult one to do. So it's if you can give somebody, like Olu was saying, you can give somebody strategies. I can give you strategies and I can tell you how to do things, but I can't necessarily feel where the swallowing is happening. That's about the only downside to it. So, but yeah, it works. You can do it. It's not a problem. Cognition is probably the easiest one. Working on memory, judgment, reasoning, and what we're doing. People always think we're like psychiatrists or something. I'm like, you could have been crazy long before you got here. It ain't got nothing to do with me. So what I do is you talk to them about different things they can do around the house. If you can't remember certain things, I know they sound common to us, but making a list of things, keeping a calendar of events and your doctor's appointments and things like that, things that people may have not been doing already before, so all kind of different stuff.
Yeah, I think that, I mean, I feel like speech therapy and physical therapy, you would think would be more difficult. Some people don't really think that that's an option when you do telemedicine, but it definitely is. I think that it's
Yeah.
awesome that you guys have ways to reach through to patients like that. I know from a medical standpoint, um, telemedicine has been around prior to the pandemic, obviously, mainly for those people that are in rural communities where they're not able to get to doctors as easily. So they can reach out um, to their providers so they can get treated. But there's different ways of doing it. So there's even like in the rural areas, there may be a particular place that they would go to that has a screen that they would go and connect to their provider with. But
Quite honestly, you can connect anywhere. I mean, you can go
yeah,
to the local library, you can go to your friend's house, you can go. I mean,
right.
really,
Now we got cell
whoever got
phones and
Wi-Fi.
tablets. Yeah, now we got cell phones and tablets, and my patients connect to me with their phones. They'll be talking to me.
Yeah.
So, it's like, I got high blood pressure, and as long as that patient has their cuff at home and they can give blood pressure, and, we can talk about what medications they're on, their diet, all of
Yeah.
those things. So commonly I'm treating UTIs even. If you have symptoms of
Oh wow.
UTI, I've had patients with STDs talk to me.
Yeah.
Things there are a lot of different things, and there's ways to send people to their local labs to get their lab work drawn so you can get follow-ups and things like that. So there's a lot of opportunity in telemedicine, and I know a lot of people are afraid of it sometimes. And yes, there are times where it's not appropriate.
Right.
Um, like if you're having chest pain, telemedicine is probably the route you need to go. You probably need to go to the hospital and get
Yeah.
that checked out. You know what I'm saying?
Yeah.
So,
Yeah.
there are certain things that you really need to just think of it, if you're not breathing, if you're having chest pain, go to the hospital. If it's something more minor, something like a medication refill, or you got this ache you're not quite sure about, but you just want to get some medical advice on, do you think it's something serious? That's a good, way to do it, as long as you're stable,
That's
you're
it. Yeah.
stable. A stable thing that can get fixed.
Yeah.
I got a question for Darnell and Lakeisha. They want to know how much money y'all making.
Oh, bust out the oh.
Yeah, Olu, how much money you making, Olu?
Hey, wait, hey, Ella, it all depends on what you do. You know what I'm saying? You can work a full-time gig and you can make on an average $80,000 a year. Okay. Then you can do PRN work, which is as needed, where they just call you up and be like, hey, you available on Saturday? And you can get a grip on that one. Now that's where you make cheddar right there, is at PRN. Because they
Exactly.
don't pay benefits.
Yeah. But
Yeah.
they'll pay you a much, much higher rate than whatever the full time rate is.
Yeah.
So for PT is about the same thing. I would say 80 to well, I'm comparing that. This is because I'm in the DC area, so 80 to 100,000 for the DC area. Probably for places like New York and LA, I'm sure it's probably a little bit higher than that. Now, if
Yeah.
you're in the middle of nowhere in Kansas, then it's going to be much lower. It's going to be,
Right.
I've heard of 50, 60, $70,000. But for those places, that's probably a decent amount of
Cost
money.
of living's different.
Yeah. But yeah, I would say 85 to 100,000 here. If you kick in some PRN, you can start to push up to 120.
You,
If you're doing
you
a lot
might
of
be able to get
PRN,
that Tesla.
150. Yeah.
I feel
If
like
you only sleep like 2 hours a day, you might hit 200.
Seriously, real talk
No,
though.
I'm serious. You
Yeah,
might.
if you did PRN full time, and man,
in the NP world, primary care nurse practitioners don't make as much as acute care nurse practitioners.
ah,
So primary care nurse practitioners, they're more around depending on where you live, that's the other thing. So it seems to be more so toward even like East Coast areas or, like New York, maybe
drop
more
them numbers, girl.
California, more income. Okay, so we're talking at least 90 to start and then up for
Oh, I chose the wrong
for
job.
for
Right.
your primary care situation. Now, when I was in Cali, I started out making six figures. And
So you
then when
you
we
balling
moved,
like that?
Oh,
I mean, we're not rolling, per se,
she
but
got
I
that
mean, we're
money
doing okay.
already.
We're doing okay. But also when you do specializations, then there's more with that. So, like in the psychiatric world, you're gonna get 150 and up is really kind of like the range. But in acute care, you're getting 150 and up as an NP starting out. So that's really kind of like the difference. Like there's a big gap in the primary care versus acute. For me, I chose primary care because I wanted more time with my patients, more one-on-one, more education, because I really like that piece of nursing. And I also chose it because it fits better with my family life. Like I knew I wanted kids and a whole, family life, go to kids' games after work type of thing. And
Yeah,
I work from 8 to 5 and be off and see my kids. Now in the hospital, you may be working 12-hour shifts, on call and all that other stuff. So it really just depends on what your expectations are. The money may be there, but is the time is really the
Mhm.
question.
And I would say, as far as physical therapy, it depends on your setting that you work in too. Skilled nursing facilities tend to pay a little bit more. If you do home health, you get paid per visit, and that ranges anywhere from $80 to $100 per visit. And those visits might be about 45 minutes. So if you want to do the math for yourself after that, you can make a lot of money doing home health. But there's pros and cons to that because you're gonna have to do a lot of driving. Um,
yeah. Home health is tough for me. I don't like going in people's homes,
I
man.
don't like home
I'm
health.
serious. It's like you got anywhere from nice homes to hoarders to unsafe conditions to dogs to you never know what you're gonna get. I
yeah,
try. Oh, it's rough.
I did it for 4 years and it was interesting. I've been to like executives of companies' houses.
Right,
I've been to like the hood where they were like,
right. That's what I
don't
said.
come today because somebody shot up the window or something like that.
Right.
You know, the OT, funny enough, that came right before me one time was actually robbed at gunpoint.
Ooh.
Yeah, I've been in the hood for.
No, I'm not going there.
Yeah,
Okay.
yeah. They were
Like,
like,
look, dog, you're gonna have to
There.
come. You're gonna come around the corner here now. I'll talk to you, but I ain't coming to your spot.
yeah. But I don't
All
know.
right, audience. Now is the time for your questions.
All
Alright.
right.
I'm not able to diagnose or treat you, but if you have any general questions, we are open and ready to receive.
Well, I know Kyle had a question. Aside from your day-to-day work, I gotta put my spectacles back on.
Are there any opportunities for leadership management within your career fields?
Absolutely. There are directors positions at
Right.
every facility. As a PT with a doctorate, you probably could have with a master's too.
Yeah.
You have a little bit more weight behind your name to start your own business. When
Yeah.
people hear doctor, it sounds, a little bit
Fancy.
more magical than just I'm a physical therapist. On my card, I have to have doctor, but I have
That's
to.
right. That's right. You
Yeah,
earned it.
exactly. So I mean, there's definitely for PT, there's tons of leadership positions out there. I know that one uncommon setting that some big companies like Google and Microsoft may have a physical therapist on staff, and they're just working on ergonomics. So making sure that your chair is upright, making sure that the computer is at the right screen, so that physically you are doing well enough to be productive for the company. So there's been research done where if you're slouched over and you're like this, you're less productive. So you're actually saving that company a ton of money.
Let me sit.
Exactly. Sit ups.
So
Don't be
in
like
you
me.
there's a lot of different opportunities. There's teaching. Some nurse practitioners go on to do, teaching clinicals for other students. So the like back to the RN world, you'll go back and teach the RNs, the LPNs. You can be a teacher at the schools, just for lectures and things like that. There's also director of nursing positions that nurse practitioners can also hold if they wanted to. I don't know any practitioner that's done that, but it's a possibility. And also hospital administration, just in general. There are leadership positions that you can, you know, decide to go into.
It says regarding your specialty, are there any new patient treatment techniques that you're interested in learning more about?
Hmm.
Ladies
For me,
first.
there's STEM. There's stimulation where they have electrodes that will provide treatment for your swallowing. So I would like to learn more about that, but that's a credentialed thing. So
Mm.
that's
For
about time.
for physical therapy, there's something that's really popular right now. It's called dry needling. The closest that I could compare it to is kind of like acupuncture a little bit, uh,
Okay, a little bit.
but it's right into trigger points and all that. And like you said, it's a credentialing thing and putting the time and the money into it. I want
Yeah, I mean, it's like, man, we just finished talking about how many years of school we did. You know what I'm
exactly. I remember.
saying?
I think for me, right now I'm learning about psychiatric NP world. So recently we really started talking more about cannabis and how that's treating patients with their psychiatric disorders. And so I
Next
think
episode.
right. Tune in for the next episode on that. But that's something that I really am really interested in to learn more about because I mean there's information out there about people that use it, but there's not like specifics on it. So
Yeah, yeah, yeah.
I
We'll
really
we'll, we'll get into that one because there's a lot I got to say about cannabis
right,
and
right.
cannabis as it relates to speech pathology because of the cognition aspect of it.
Oh,
Mm,
okay. I don't
Yeah,
know about that.
yeah. So just a little teaser. There was a new study that came out saying that after a 20-year study that they found a link from cannabis to schizophrenia.
mm.
So we'll discuss more about that next
Yeah, interesting. Okay.
time.
What are common and uncommon workplaces that you see physical therapists, speech therapists, and nurse practitioners work?
Um, there's a few uncommon places. Most people don't know that physical therapists can do wound care. Um, we go in there with people with ulcers and we clean them out, and
Y'all
it's
big ballers,
and
what?
it's
That's that
uncommon.
doctor.
I
Yeah.
only know a few. I only know a few PTs who actually do it. Another area, physical therapists do PT with animals. I've seen them do it with horses and dogs,
Oh
and
wow.
yeah, they have the same joints that we do. They have ACLs, they have PCLs, they have ankle
Well,
issues.
yeah, you got to make money on them horse races. Somebody got to take care of them horses.
Exactly.
I
So
didn't think about that.
yeah, rehab for like dogs is like very expensive.
Right.
So
So, real quick, someone asked, please, miss in the beginning, please tell me about the topic we're discussing: our careers, our career fields, and paths. So,
he want to know why we hating on the hood. We're not hating on
right,
the hood.
we hating on having to work in the hood when we don't want to get hurt. That's
Exactly.
all. I just don't want to get hurt.
Yeah, we would like safe environments when we go to work.
You know,
That's the ideal situation. We
you
want
know
to
that
But
small thing of wanting to come home.
finish seeing our patients.
you know what's funny is as a guy when you go to like the hood, I mean, they see you in your scrubs and they most of the time they don't really mess with you because they know you're there to help
Coming to
somebody.
work.
You're here to
Right.
help grandma or to help a kid or something like that. So that's why
Yeah.
to me when I heard that the OT was robbed before I came in, I was just like, really? I guess she
Was
must
the
have been
OT
wearing regular
white?
clothes. I didn't want to say that, but yes.
Well,
and
I mean,
and
Look,
it
this
I
is
think
is
she
what
was
it
wearing
is.
the
Venezuela,
regular
okay?
clothes. Yeah,
I mean, you didn't fit in. I mean,
Oh
yeah.
no. Okay, so from uncommon places for nurse practitioner, I don't necessarily think of anything super uncommon. I mean, like I know that we've done things like IV therapy, hydration clinics,
Ah,
um, which is
Hmm,
where they basically just go around and hydrate people, and people love that. That's a thing now.
huh.
Um, what else?
hmm.
Botox, but that's a medical thing. So
Yeah, but I would have never thought a nurse practitioner did Botox. Okay.
Hmm.
Speech is dry. Sorry, we ain't got nothing.
you have to get training for it, but
You
Yeah,
don't
well,
do
there's
speech
nothing
therapy for
special.
animals?
No, no, no. Ain't nothing speech. No, speech can't help you. Nothing else. It's basically medical setting, acute care, hospitals. That's basically it. You got, all the different pediatrics and geriatrics and all of that, but no uncommon settings that I can think of.
Hmm.
So,
all right. We hope you tune in with us again in 2 weeks. Connect with us on our business and social media pages. If you're watching after our live session has ended, you can still leave your question in the comments. If you leave any suggestions if you have any suggestions on a healthcare topic you would like us to cover, send us a DM.
and
And well,
our next episode is cannabis. So
yes.
watch out.
Really, Olu?